Hi, this is Fee. Thank you for tuning in again to our weekly update. It's been quite a week. Last week I announced that a resident at the Springs at Lake Oswego tested positive for COVID-19. Our team sprung into action, including our industrial sanitation and the deployment of the tests for employees. Very happy to report that the resident is doing well, his family's in good spirits, and no resident or employee has tested positive for COVID-19. On Friday, lightning struck again when we learned that an employee at the Springs at Bozeman tested positive. Our teams went into action and did the exact same protocol that we did at the Springs at Lake Oswego, which included industrial sanitization of sites impacted and tests of all employees. This time, those tests revealed that we had 2 other employees that were asymptomatic, meaning they had no symptoms, and they were positive. We sprung into action with our healthcare team. We flew 50 more tests up to Montana, where along with the Montana Health Department, we tested all residents at the Springs at Bozeman. We're happy to report that every test came back negative a little more than 24 hours later. Residents are safe, staff are safe. All staff up there are doing well. We're holding the line. What we've learned from these 3 engagements at the Springs at Clackamas Woods, the Springs at Lake Oswego, and the Springs at Bozeman is that COVID-19 can strike anywhere. It reminds me of growing up in the mountains at Lehman Hot Springs when I was a kid. And those late August thunderstorms would roll in and the lightning would strike. You never know where it was going to happen. But the keys to fighting that fight was 1, vigilance, always watching, and number 2 is preparedness. You had to have the equipment and you had to be prepared. In this fight against COVID-19, we have the equipment, we have the PPE, we have the tests, and most importantly, we have the team, the healthcare heroes, to fight this fight. In the mountains at Lehman Hot Springs, we had a 1942 fire truck that my grandfather bought from the city of Pendleton. I have distinct memories as a kid of jumping in that fire truck and heading to a lightning strike with my dad. The lessons about fighting forest fires from my childhood have some relevance today. In fact, we still have the fire truck right here in McMinnville, reminding us that we can win this fight. I want to say a special thanks to our leadership team who are taking action and making the details happen. Led by Jay Leo, Brenda Conley, Molly Vaughn, Amy Brown, Laura Larson, Eric Christensen, Tracy Darcheny, and Gregory P. Smith. Thank you. That leadership team, through our Hold the Line strategy, is asking us to make some enhancements to stop the drop. We're now requiring everybody that's in our communities to wear a facial covering when they're around others. In your apartments as residents, you're welcome not to wear a mask. But outside, around other people, please join and stop the drop. Let's stop this virus. I want to give a special thanks to our volunteers today, and 2 who emailed me this morning, Kathy Woodford and Sarah Wilkinson, both who have parents at Springs Living Communities. Thank you for volunteering. Thank you for making more masks. We appreciate you. I also want to thank our healthcare heroes, our original healthcare heroes, Carlotta from the Springs at Clackamas Woods, who tested positive as an employee over a month ago, returned to work yesterday. She sent me a picture today of the notes she was writing to residents on the coffee cups as she delivered them this morning. Carlotta, we're glad you're healthy and we're glad you're back in the fight. Thank you. This week's healthcare hero that I'd like to highlight is Sage. I spoke to Sage, who told me about her experience, how she insisted that she be tested for COVID-19. And then when she was positive, called the community immediately, and we adopted our protocol. Sage, thank you. You have saved lives at the Springs at Bozeman. Stay tuned for some exciting advancements and innovations that we're working on to enhance the quality of life in all of your communities. Thank you for listening, and be well. We didn't forget, we heard your requests, and we're working right now in Oregon with the State of Oregon and Oregon Healthcare Association to be able to start our salon services. I don't know about you, but I'm feeling like I need a haircut.